My patients are like family to me. If they came in with a serious back problem, I usually referred them to a surgeon. But not anymore.
Welcome to the VAX-D Physicians Network. VAX-D therapy is the non-surgical solution to serious low back problems. "85% of us will suffer from serious low back pain at some time in our lives. For people under the age of 45, back pain is the major cause of disability and lost time from work. In fact, it is the second most common ailment seen by general practice physicians each year. And it is the #1 healthcare expense in the United States, costing $80 billion annually. If low back pain is making your life miserable, vertebral axial decompression may be the answer. VAX-D is a non-surgical therapy developed for the treatment of serious low back pain. This breakthrough technology was invented by Dr. Alan Dyer, former Deputy Minister of Health of Ontario, Canada. Dr. Dyer is also known for the development of the heart defibrillator. VAX-D therapy uses FDA-approved technology along with clinically proven principles to relieve pressure on vital structures of the spine, including the discs and spinal nerves. It is not just aimed at treating symptoms, but is designed to alleviate the underlying problems that cause low back pain. In a structure as intricate as the spine, a lot can go wrong. The spine is made up of a series of bones called vertebrae, each cushioned by a soft, shock-absorbing disc. Probably the single most troublesome portion of our back is the lumbar spine, or lower back area. It is usually the area of the spine which receives the most stress and strain. As a result, more spinal problems occur in the lumbar region than anywhere else. And just how much pressure do our backs have to deal with? Even when we are lying down resting, our lower lumbar discs have a pressure of 75 millimeters of mercury pushing on them. When we simply stand up, the pressure increases to more than 100 millimeters. If we lift a medium-sized box, the pressure on the discs increases to more than 375 millimeters. And if we lift the box wrong, by bending over at the waist instead of at the knees, the pressure is more than 750 millimeters. That's a lot of stress on the muscles, vertebrae, and discs in our back. It is no wonder that 80% of all severe back pain is caused by problems in 3 key areas.
Here you're looking at a disc from the top. The front is up, the back is down. This is the left side, this is the right side. The disc is oval and consists of 2 different kinds of tissue. There's an outer ligamentous tissue which is tough and strong, and there's a center jelly-like tissue which is mucoid and allows for a certain amount of compression. This system allows these vertebrae to move back and forth a certain distance. It protects these open spaces in the back while allowing that movement. These open spaces are also 2. A large space in the center through which a tube carrying the nerves to the lower body runs, and second, at each segment, smaller side spaces through which nerves to individual components pass.
I hurt myself doing the simple thing of moving a 44-pound case. I'm in air transportation, and the simple fact of trying to move that popped a disc in my back. It's funny how something as simple as and as small as that can change your life. It hurt. It hurt. Felt like somebody was sticking an ice pick in my back. It drove me actually to my knees. I went to the doctor, and he took x-rays. Couldn't find anything wrong. Figured it was a muscle or mechanical type problem, so they recommended some rest and some physical therapy. But when the pain didn't go away and there was nothing on x-rays that showed there was a problem, I had an MRI. The MRI showed that I had a protruding disc at the L4, L5 level. That was causing problems with leg pains, shooting down my left leg. What was unfortunate also about it is that I'm the safety manager at my job, so I had the dubious distinction of being able to put my own name in the OSHA log. I got a lot of ribbing from my friends on that, as did my coworkers. I went through physical therapy, and that was supposed to work as far as pain management, but the pain didn't go away. It kept on aggravating and being there. I couldn't sit comfortably. I couldn't stand comfortably. I couldn't lay down comfortably. As a matter of fact, I spent 10 weeks sleeping on the floor with my knees elevated to give myself relief from the pain. I finally heard about VAX-D, which is a simple non-operative procedure. I decided to do some homework, go look into the procedure, and through the procedure, I actually went through it. My company approved getting the procedure done. I went through it, and the pain went away. It was amazing. I was an active person. I played tennis, I do a lot of yard work, and I went from that to being like an 87-year-old hobbled man. I couldn't even lift my briefcase. Once I went through the procedure, the pain was gone. I'm able to run and jump, play tennis again. My wife's happy because I can do yard work again. And a follow-up MRI showed that there was no indication of any type of trauma whatsoever. The disc is back in place, and it doesn't even look like I was injured. I'm healthy. I have no pain. I'm playing 4 hours of tennis 3 times a week. I'm back to normal. It's amazing.